Hey everyone, and welcome to the Deep Dive. We're diving deep today on a topic that's really important for all of you, future mental health nurses. Stigma,
Yeah.
you know, surrounding mental illness. We've got tons of research, personal stories, expert opinions to give you a fresh perspective.
It is fascinating how far we've come in,
Yeah.
talking about mental health. But stigma's like this, like a shadow. It just won't go away.
It's true.
And you guys, as future nurses, have a real chance to make a difference here.
For sure. Actually, one of our sources today, it's this really inspiring story of Lori.
Oh, wow.
She struggled with mental health herself.
Yeah.
And she became a successful psych nurse.
That's fantastic.
It shows how much your compassion and understanding can impact a life.
What's so important to remember is that mental illness, it's a medical condition.
Right.
Just like any other.
Yeah.
And Dr. Jeffrey Lieberman, he's this renowned psychiatrist.
Oh, yeah.
He explains it beautifully in his TEDx talk.
Okay.
He compares it to heart disease. Heart disease affects the heart. Mental illness affects the brain.
That makes a lot of sense. It takes away the blame and shame that so many people feel.
Totally.
Wrongly associate with mental illness.
It's not a personal failing. It's not a weakness.
No. So things like depression, anxiety disorders, schizophrenia, they impact how the brain functions,
Right. Precisely.
affecting thoughts and emotions and behavior.
And it's way more common than you think.
Really?
The World Health Organization, they estimate 1 in 5 people
Wow.
will experience mental illness at some point.
That's huge.
Think about that. That's probably a few people in your own circle, friends, family.
Yeah, that puts it in perspective. But there's still so much stigma around it. It's like a barrier keeping people from getting help and living their lives.
That's a powerful force, rooted in fear and misunderstanding.
Right.
Think about historical examples like the Scarlet Letter or, the yellow stars
Oh, yeah.
Jews had to wear back in Nazi Germany. Stigma marks someone as different, other, in a negative way.
Separating us from them. And that creates a lot of shame and isolation for the person.
Yeah, and it has serious consequences.
Oh, I did.
Dr. Lieberman asked this question in his talk, and it's a good one. Imagine having to cancel plans
Okay.
because you're sick. Would you rather say you have a kidney stone or that you're depressed and suicidal?
Wow. Yeah,
Most people would choose the kidney stone,
probably. Yeah.
even though both are valid reasons to cancel.
Of course.
It shows how deep stigma is.
It does. We're way more comfortable talking about physical stuff than mental health.
And that silence can be deadly. People suffer alone. Symptoms get worse. It can lead to crises.
And that's where you all come in. Future mental health nurses. You're going to be the ones on the front lines, challenging stereotypes, creating a better environment.
It starts with understanding how much stigma impacts people. Feeling judged, ashamed, like a burden. It's isolating. It's exhausting.
Like carrying a weight, making it harder to cope with the challenges of mental illness.
And it's a cycle. They're afraid to seek help. So it gets worse.
Because of the stigma.
Right.
Which then reinforces the stigma.
Exactly. And then there's what they call the why-try effect. It's basically self-stigma. People believe the negative stuff and think they're incapable or unworthy because of their mental illness.
It takes away motivation and hope.
That's heartbreaking. Your role is crucial to create a space where people feel safe, heard, understood.
Absolutely. And that includes watching the language we use. Labels like druggies or schizophrenic can be so dehumanizing.
It's true.
They just become their diagnosis.
Yeah.
And it reinforces those stereotypes.
In one of our sources, there's this Facebook post. Someone shared a picture
Okay.
of needles found in a park. And the caption was, apparently these were left by druggies.
Oh, wow.
And the comments were full of hate and judgment, all focused on that label. Instead of seeing the person.
It's a reminder. We jump to conclusions. Dehumanize people who struggle. Instead of compassion and support. Right. They become the other. And a threat.
Right.
So what does all this mean for you? Future nurses. You need to be aware of your words. Choose them carefully. Advocate for your patients. Challenge discrimination. Create a space where they can share without judgment.
It's about shifting the culture from blame and shame to understanding and support.
Yeah.
Recognizing that mental illness is not a failing. It's a medical condition that deserves care like any other.
That brings up a really important point. Equality and equity in healthcare. They're used interchangeably, but there's a difference. It's a big one.
Huge difference, yeah.
It affects how we approach care.
Absolutely.
Yeah.
So equality, that means treating everybody the same.
Right.
But equity means giving people what they need to succeed
Okay. Yeah.
in mental health. That means understanding that not everyone starts in the same place, and they need different things to reach their goals.
Like that saying,
Yeah.
if you give everyone the same size shoes,
Uh-huh.
some people are going to trip, others will be drowning in them.
Ex-
Equity is about making sure everyone has the right fit so they can walk their path comfortably.
And sadly, stigma and labeling, they lead to these big inequalities in healthcare, in access, in quality.
People from certain communities,
Yeah.
marginalized communities,
Yeah.
people with certain diagnoses,
Yeah.
people without resources, they face more barriers getting the help they need.
Definitely. And that's where you guys come in. You're advocates.
Right.
You can be the voice for those people who are often overlooked
Yeah.
to make sure they're getting the right care, no matter who they are
Yeah.
or what their diagnosis is.
It's about challenging those practices that are discriminatory,
Yes.
pushing for funding, better services, policies that actually work
Absolutely.
for diverse populations.
It's about building a system where everyone has the chance
Yeah,
to reach their full potential.
I like that. Okay, let's talk about something else.
Sure.
Lived and living experience.
Yeah, this is important.
We have some awesome sources today that highlight how important this perspective is for mental health care.
Imagine being able to ask someone who's lived it
Yeah.
about their journey,
Yeah.
what helped them, what frustrated them
Yeah.
when they worked with healthcare people.
Those are amazing questions to ask.
Yeah.
And one of our sources, nursing students, got to do just that
Wow.
with guest speakers who have lived experience.
That's powerful.
It is. We also have an article, it's called Not My Words, Not My Story.
It
Basically says, listen to your patients. Don't just impose your professional thoughts on them.
Right, because we may be experts in diagnoses and stuff,
Yeah,
but the patient is the expert on their own life.
totally. Their story is theirs. It's ours to listen to and learn from.
Exactly.
So this is where skills like active listening become so important.
Oh, yeah.
And narrative competence, trauma-informed care.
These are key. As mental health nurses,
You're going to work with so many people facing different challenges,
right.
and how you approach them. It matters. It impacts their journey.
For sure. Active listening. It's crucial. You have to really hear them, what they're saying.
Yeah.
Verbally, non-verbally. Validate their experience, even if you don't totally get it. Create that space for them.
A safe space to open up.
To open up, yeah, without judgment.
And narrative competence goes even further.
Tell me more.
It's not just listening to their story, it's understanding it.
Okay.
The context, the meaning, and emotions. It's seeing the world through their eyes.
You got to see their world and realize their story is shaped by their life, their experiences, culture, beliefs,
Right.
their values. And, you know, many people with mental illness have experienced trauma, physical, emotional, social trauma.
So important to work in a trauma-informed way.
It really is.
Yeah.
That means knowing that trauma exists, understanding the impact,
Right.
and creating care that is sensitive to those experiences.
Preventing more trauma.
Yes,
Prioritizing safety. Empowering the patient.
exactly, to regain that sense of control. And remember, recovery isn't about fixing people,
Okay.
making them normal. It's about supporting them on their own journey
Right.
to a meaningful life, however that looks for them.
And it's not a straight line. It's up and down, setbacks and breakthroughs.
For sure.
Your job is to be there, steady, encourage them, guide them, believe in them.
And that brings us back to Lori. Remember her? She had a rough time.
Oh, yeah. Borderline personality disorder.
Right. She felt let down by the system.
But then she met Dr. Lieberman.
Oh, yeah.
He treated her with respect, compassion, no judgment.
And his belief in her, it made all the difference.
It did. Years later, she became a psych nurse. Successful one, too.
Wow.
She wrote to him to thank him.
That's so cool.
She said, I feel like I've been let out of prison, like I got my life back.
Wow. That is
Oh,
powerful.
it's a testament to the power of care.
Compassionate care.
Yeah. Her story shows us
What does it show us?
recovery is possible.
Even with tough diagnoses.
Yeah. And you, as future nurses,
Yeah.
can have that kind of impact on someone's life.
Absolutely. But it's not just about individual efforts. We need to think bigger. Address the system.
Okay.
The things that cause stigma and inequality in mental health care.
We can't just focus on attitudes. We need to look at the barriers,
Right.
the things that prevent people from getting quality care,
Yeah.
lack of funding, resources, discriminatory policies.
Exactly. If we want a fair system, we need to address these things.
And the media, too. They play a role
Oh, yeah.
in those stereotypes, sensationalizing mental illness.
It creates fear and misunderstanding. And that fuels stigma.
It's about recognizing that. Stigma is not just a personal problem, it's societal.
It is. And it takes a collective effort to dismantle it, to build a fair system for everyone.
And that's where advocacy comes in.
Oh, yes.
You can advocate not just for your patients, but for your profession, for a better system.
Yeah.
For everyone. You can speak up against discrimination, challenge those bad policies, educate people about mental illness. There are so many ways to make your voice heard.
So many ways. Join organizations, community initiatives, contact officials.
Yeah.
There's power in numbers. Together, we can make change.
And you don't have to do it alone. There are so many organizations out there, so many people.
You're fighting for mental health justice.
Connect with them, learn from each other,
Yeah.
amplify each other's voices.
We're stronger together.
So as we're wrapping up, it's important to remember every journey is different. There's no one size fits all.
Right. We need to move away from that thinking.
Yeah.
Treat everyone the same. We need individual care.
That meets their needs.
Their circumstances.
It's about understanding that their background, their culture, socioeconomic stuff, lived experiences, it all shapes their journey.
One of our sources, it's this tutorial on mental health nursing. They really emphasize this point. They talk about these inequalities, how they impact people's access to education, jobs, decent living standards, healthcare, fair treatment, even their ability to participate in decisions that affect their lives.
It shows that stigma. It's not just this concept. It creates real barriers, preventing people from really living.
It does. And that's where you all come in. As future nurses, you can advocate
Yeah.
for policies and practices that promote equity and social justice.
Yeah. We need to challenge these systems
Yeah,
and push for real change.
absolutely. We need to be champions for those who are marginalized, silenced, make sure they're heard, and get the support they need.
Right. And that brings us back to language.
Oh, yeah. Words matter.
We've talked about how labels can be dehumanizing, but it's worth repeating.
It is, because words are powerful.
They can either make stigma worse, or they can help us dismantle it.
That tutorial, they use a great example about a Facebook post. Someone posted a picture of needles found in a park. They automatically labeled those people as druggies.
The comments were just...
Awful. Full of judgments, negativity, reinforcing stereotypes, dehumanizing people.
It's a perfect example how a label can reduce someone to one thing, usually something negative.
Yeah, we forget there's a person there
Yeah.
with their own story.
It's like we're saying, they are their diagnosis.
Yeah.
Instead of they're living with it.
It's a subtle difference, but it makes a huge difference in how we treat each other.
The tutorial actually offers some alternatives. For example, instead of addict,
Okay.
you could say person with a substance use disorder. Instead of schizophrenic, you could say person living with schizophrenia.
These are good changes.
It helps us see the individual, recognize their humanity, their worth, no matter their diagnosis.
And that's how we create a culture of compassion, of understanding, where people feel safe.
To get help without judgment.
That's what it's all about. Treating mental health with the same respect as physical health.
Where people can get help without shame, without fear.
Exactly. This deep dive has given us a lot to think about.
It has.
Understanding stigma, equitable care, respectful language.
Yeah, it can feel overwhelming. But even small things can make a difference.
You don't have to do everything at once. Just start somewhere. Maybe correct someone's language.
Yeah.
When they're being stigmatizing, maybe share a personal story. To challenge stereotypes, maybe educate yourself more about mental health.
There are so many organizations out there, so many people fighting for mental health justice. Like, see me, Mine Jersey.
They offer ways to connect, share resources, get involved.
Remember Lori's story?
Oh, yeah. The nurse.
She felt let down by the system, and she became a mental health nurse. Her journey shows us change is possible.
Hope is always there. And you, as future nurses, you have the power to be part of that change.
Every interaction, every time you speak up, every time you advocate, you're building a better world,
A more compassionate world.
a more understanding world. And that's a world worth fighting for.
Couldn't have said it better myself.
Thanks for joining us today on this deep dive. Keep learning, keep growing, and we'll see you next time.